much. I too am humbled to be here this morning. There are many in the room who I know are more deserving than I of being honored in this way. But I was further humbled in talking to my two daughters, one in Cleveland, who, upon hearing about my being honored in this way, immediately went to the calendar and said, "Did you know that this is also Appreciate the Aged Day?" My younger daughter, who is a new homeowner in the lovely town of Milton, a neighbor of the governor, not able to be here this morning, but she admonished me and wanted me to make sure that I did not tell any stories that they have heard 100 times before, and that many people in the room have probably heard 10 times before. She calls that anecdotage. So any of you who are in that arena, keep that in mind. I will be ending my tenure with the Department of Mental Health at the end of this month, but I'm somewhat in denial. I keep going to meetings. I keep planning for meetings. I'm going to pull a George Costanza and show up, have a closet somewhere that I'll be staying in. But as I thought about the work that all of us have done, your work life is really your best reward in doing good work and working with people who are innovative and creative and dedicated to what they do. And I've had that privilege over 40 years now of work in housing and homelessness. My efforts began with the Department of Public Welfare that created a housing coordinator role way back in the 1970s. I worked for a project called the Experimental Housing Allowance Project, which was the precursor of the Section 8 program. People don't realize it, but there was an experiment. Springfield was one of the sites of that experiment, made nationally, to test the idea of a Section 8 model. I was able to work there with Amy Anthony, who later became the head of the HCD, Art Kember, Carol Walker, I see is here, who's been there from the beginning, and tremendously innovative work. Shortly after that, the second housing court in the nation was created. The first in Boston, the second was in Western Massachusetts. And Judge John Graney, who later became the state Supreme Judicial Court Chief Justice, was our first housing court first housing court judge, and he created a Citizens Advisory Council very creatively, and I sat with John Grady, as did many of the people here, to begin to forge the work that the housing court, the important work the housing courts do throughout the Commonwealth. More recently, we have created innovative programs, I think, in Western Mass. Programs like the Tenancy Preservation Project had its origins in Western Mass, closely with Ann Anderson at MH, which is Mass Housing, and with Judge Abraskin, and now Judge Fine, Judge Fields. I think we helped Bob Polster in his efforts to model the networks that have been created across the state with the innovative work that Liz Sullivan and others in our area did to create a Western Mass Interagency Council, which really led to the development of the networks. Just so many people to thank and to be reminded of the work. I see Doreen Fadis, whose work with healthcare for the homeless has been monumental. As you know, chronically homeless adults die at an earlier age than any other subpopulation in the country. And we're all too well aware of that, and to recognize the importance of medical care in addition to all the other kinds of support that folks need. Jerry Ray is here from the Mental Health Association. He was an early innovator. Before we even defined chronic homelessness, his work and his team developed shelter plus care programs and safe havens programs, and other innovative efforts to serve this very needy population. My good friend Jay Levy is here, along with Larry Gottlieb from Elliott Homeless Services. Their work in the field is absolutely essential. They are on the front lines, and they're working with homeless folks in the shelter and on the street. I take a moment for shameless commerce. Jay Levy has written a book called Homeless Narratives and Pre-Treatment Pathways from Words to Housing. It's been excellently reviewed. Anybody who is working in the field needs a copy of this as a guide to working with the chronically homeless in their areas. It's our hope that through the work that is being done by everyone here, that chronically homeless adults and families can be housed, housing first in an important way, and that at some point, what we know in the Department of Mental Health is that when folks are housed affordably and safely, they get better. It's good public policy, and it's morally the correct thing to do. And our hope is that sometime very soon, folks who are housed will call their housing home. And I thank you again for this award.